Hello and welcome to this new podcast of the American Journal of Public Health. And here I am with my great co host, whom you know well now, Vickie Mays. And we have a chance today of interviewing Professor Marion Nestle. And I'm sure most of you know Marion works because you've read her books, so the politics and different other books about nutrition and health. She's a pioneer in this area. She's a leader in this area. And it's clearly a topic that is going to have a great importance in the years to come. So, part of our series, What is Public Health? We would like to ask Marion, what it is to be a public health nutritionist. So, Marion, hello, welcome to this podcast.
Glad to be here.
Well, you sound so, and that's great. So, Marion, just let us know what it is to be a public health nutritionist. It sounds to be like a very special type of job, a public health nutritionist.
Well, maybe I should talk about what it isn't first, because there are two kinds of nutritionists. There are nutritionists who do dietetics, which is nutrition for individuals. It's you go into a hospital, you find out what sick people need to eat, you prescribe diets for them. And in contrast to that, there's public health nutrition, which, like everything else in public health, is for populations. And here you're interested in the largest the largest nutrition problems that affect large populations of people. And these days, that means not having enough food, what we call food insecurity, which affects 1 billion or more people in the world today. It involves overconsumption of the wrong kinds of foods, and that leading to weight gain, obesity, and the chronic diseases for which obesity is a risk factor, a problem affecting very large percentages of the world's population, especially in high resource countries. And then the effects of food production and consumption on the environment, which affects everybody. And those three issues are the main public health nutrition problems in 2025, and they occupy the attention of public health nutritionists who are eager to prevent undernutrition and malnutrition and the lack of adequate food, interested in preventing obesity and chronic diseases, and interested in preventing the effects of food production and consumption on climate change. Those are big jobs.
How
Yep.
did you decide to do this? I mean, it's like we have students and they will decide to do nutrition, but you like have this really great view of how to do public health nutrition. How did that happen?
Well, it's probably because I wasn't trained in nutrition. My doctorate is in molecular biology, and I got interested in nutrition because I was handed a nutrition course to teach when I was teaching in the biology department at Brandeis University, and I had to learn it in a hurry, and I had to learn it very deeply because I then went and started teaching it to medical students at the University of California, San Francisco. And it wasn't until that job fell apart that I was advised to go to public health school. And going to public health school was an amazing experience for me because I thought I knew all that stuff. And I did in a way. But what public health training did was to coalesce my understanding of nutrition and its function and its role in society and provide a framework for talking about it that I had never had before. It was extraordinarily useful. I loved public health school. It was just a great experience, and it did what it was supposed to, which was to open up the next position on the basis of my having gone to public health school. I got a job in Washington during the Reagan administration, editing the Surgeon General's report on nutrition and health. And by the time I finished all that, I knew a lot about nutrition.
What is the daily activity of a public health nutritionist? We understand now what are the issues, the topics, the contents, but what's your work?
My work personally is I write books. I teach, I give public lectures, and I talk to reporters every day. I think of myself as a public health nutrition person doing public advocacy and communicating to the general public as best I can. I think nutrition is very confusing for people. To me, it's very simple. And so I want to get my ideas about the simplicity of nutrition out to the general public. The way I put it is that, it's upstream and downstream in public health terms. I'm very much an upstream thinker. That is, I'm interested in the big picture. I'm interested in root causes. But I'm also, if the world divides into lumpers and splitters, I'm very much a lumper. I like to take all the information that's available and boil it down to something that people can understand. And one of the difficulties with nutrition is there are 50 or so individual components of food that are essential in the diet. They're all different. They all have different functions. They're very complicated from a physiological and biochemical standpoint. And yet the dietary advice is so simple that the journalist Michael Pollan can do it in 7 words. Eat food, not too much, mostly plants. And that takes care of it. So that's the difference between lumping and splitting, is I'm interested in these big sort of dietary approaches, which allow people to eat very, very different kinds of diets, not to have to restrict any particular food group, and to enjoy their food, which is one of life's greatest pleasures.
So I mentioned Southern Politics as one of your books. Which is the one among all the books you publish? You publish almost one per year or 2 per year or something like that. Is there one that you would recommend in particular for someone who is interested and considering to become a public health nutritionist?
Well, for somebody who's interested in doing professional work, start with Food Politics, which was my book that came out in 2002, and really was, I thought I was just describing the obvious in pointing out that the food industry has a vested interest in what people eat. But people who read it were very surprised. And the question that I got always when that book came out was, what does food have to do with politics? Nobody's asking me that anymore.
And that's actually a great segue in our next question is why doesn't people ask you that anymore? And
Well,
what's the current context?
Well, the answer to that question is Robert F. Kennedy Jr., who has, in his appointment to the Secretary of Health and Human Services, has taken on the food industry as one of his stated goals. In appointing Robert F. Kennedy as Secretary of Health and Human Services, President Trump referred to the industrial food complex. I can't even say it with a straight face because President Trump sounded just like me. How is that possible? How is that possible? And Kennedy, in his early statement, said the food industry is making us sick. And this is that was in a sense the theme of Food Politics, my book, Food Politics, and much of the other writing that I do in books and in my daily blog at foodpolitics.com. And so here is the Secretary of Health and Human Services saying some of the same things that I've been saying for decades.
Yeah, but Marion, it's it's not. It sounds like the same because the words are the same, but behind that, there is no understanding, and we know that
Oh,
by the Secretary of, by RF Kennedy of Public Health and Population Approaches. I mean, everything he does and says is based on anecdotes, on things that are really not the type of science we're using. So he may say the same thing, but the science underneath your work and his beliefs, I think, are very different.
yeah. I mean, the way I would describe. I mean, I was trained in molecular biology, so I'm a scientist by training, and I would say that what I do is I write extremely well documented polemics. I mean, I have a point of view, I have something I'm trying to say, I have things I want readers to do, but I document my work with excruciating comprehensiveness, or at least I try to. I would say that what Kennedy does, Kennedy has grains of truth in almost everything he says about everything, but they're only grains. And they're not based on a complete understanding of the science. And that's very troublesome. On the other hand, it is extremely exciting for me to hear a federal official at that level talk about the same kinds of issues that I've been concerned about for so long. And so the hope is that maybe he'll take on the food industry, although I'm not enormously optimistic about that. But he has certainly brought issues about nutrition to public attention in a way that nobody else in government has since Michelle Obama. And Michelle Obama, of course, was criticized by the Republicans fiercely, ferociously, for saying exactly the same kinds of things that Kennedy is saying. And I was fascinated that the first thing that President Trump did was to appoint a Make America Healthy Again commission, which within 3 months is supposed to come out with a report analyzing the state of childhood health in America. And then 3 months later to produce a set of policy recommendations for dealing with it. That's exactly what Michelle Obama did in 2010. It's exactly what the Obama administration did in its task force report on ending childhood obesity within a generation. And the response then was, this is nanny state and we're not going to have any of it. So maybe this is something that has to be done by Republicans, but I'll believe it when I see it.
I mean, Republicans have a record in public health. I mean, the NIOSH that has been dismantled today, was created by Nixon. I mean, Medicare that may be dismantled today, was incremented by Bush. I mean, there is a whole tradition because Republicans of the past also believed that by developing public health, you gave at least the impression that this society has something to offer for all the poor and the people that are marginalized. What do you think? I'm curious, Vickie, what do you think about the analogy between Kennedy and Michelle Obama?
Oh, I mean, I think that they both are speaking something that we as public health people, want to see. Now, the path is going to diverge, and that's where I'm worried. She was a implementer. He is a, pull it apart person, I think. But I want to ask Marion this question of what would be the number one thing that you would want him to do in terms of his agenda? So let's see if we can get it to the public. What would you say would make a big difference for public health for him to undertake?
Okay, I'm really interested in chronic disease prevention. 75% of American adults are overweight or obese, and obesity or overweight affects a very large proportion of children these days. So if we're going to have a healthy population, we need to stop the excess weight gain. And that means not eating as much junk food or ultra-processed food and it means being more physically active. It means a lot of changes in society that are going to be very difficult to implement. So I think we start with an educational campaign as a basis for organizing support for the kinds of policies that are going to be needed. But if Kennedy wants to do something about obesity and chronic disease, he has to take on the food industry. He must take on the food industry, and that's a problem because eating less is very bad for business. And the kinds of things that he's talking about having to change the way the food industry is doing things. We need a policy that stops food industry marketing to children right off the bat. There have been public health attempts to get the food industry to stop marketing to children since the late 1970s. When Congress, when the Federal Trade Commission tried to do that, the Congress passed a law saying you can't stop marketing to children on television, let alone social media. Fired the director of the Federal Trade Commission, and that was the end of that for years. A major report came out of the Institute of Medicine in 1995 examining food marketing to children and saying this has to stop. Food marketing to children is really bad for children. It has to stop. And if food companies won't do it voluntarily, Congress needs to get into action. And that message was repeated during the Obama administration, and it's been repeated subsequently. And now Kennedy is saying some of the same sorts of things. I want to see the action.
What do you think will be the success of attempting to do this when we may not have school lunches? We may not have school as a vehicle to help us. So we can talk about the media as much as we want. Being able to help children change their tastes, what they prefer, sometimes gets shaped by the daily meals that they partake in. What do you think should be, Kennedy's thoughts about school food?
Well, maybe I should go through my entire agenda because school food is very high on that agenda.
Yes.
I go to visit a lot of schools to see how the meals are going. And if I'm in a school that has a garden and people who are cooking real food and who know the names of the kids in the school, the kids are eating the food is okay and the kids are eating it. And they have a completely different relationship with food than if they're in a school where they're just being given packaged junk food, even if it's junk food that meets the standards of the Department of Agriculture. So I think we need to start with universal school meals, so that we're not having this ridiculous bureaucratic decision about which kids get to eat and which kids don't get to eat. We had universal school meals during the pandemic, and they were enormously successful in preventing hunger among children. The school food needs much more money than it's getting. It's the only part of the school curriculum that's expected to be self-supporting, and the Department of Agriculture does not give schools nearly enough money to produce healthy food for kids and pay the staff decently and do all those other things, which are the staff salaries are supposed to come out of the Department of Agriculture's reimbursements. I mean, it's a terrible system. And it needs to be expanded. It needs to be the jewel of the United States. I mean, it's ridiculous. I think we need universal basic income. So that, and we had more of that during the pandemic also, and it was enormously successful in preventing food insecurity. We need to get money out of politics. That's the big one. Then I think we need a restructuring of the agricultural system so it focuses on public health rather than corporate health. I have a long list of agenda items if I were in charge.
Let me add one agenda item. We need 3,000 Marion Nestles. That's what we need. And hopefully this podcast will contribute, to show people how important your work is And I want also to thank you for all the work you've done with the journal. And you've been talking about the Department of Agriculture, and people may wonder what the Department of is doing with feeding schools, etc. And thanks to you, we had a primer on the Farm Bill in the journal a few years ago. Thank you, Marion, for who you are and for what you're doing. It's absolutely fabulous. And hopefully you're right, and we'll see something positive occurring in the coming months.
Keep writing those books. It is
I'm working on it.
yes, it is not just the notion of your writing, but it is the science that you bring to it to help these industries to see the role they could be playing. And hopefully what will happen at a federal level is that evidence-based policy, if it's still the way in which we're supposed to proceed, can utilize your work.
Well, let's hope. And thanks
Yes.
for having me on.